So thank you very much. Very nice cooperation from you people. So I expecting the same cooperation for the. Okay, fine. Now what we have seen that is the hyperemesis gravidarum. We are continuing of it. You got the scenario of hyperemesis gravidarum. That is how it responds to this. So I think now what is this hyperemesis gravidarum? Why we are giving importance to it? It is harmful for both because in ops we are dealing with two, that is mother and the fetus. But what if this hyperemesis gravidarum, if there is excess vomiting, it is not affecting only the mother, it's also affecting with that of children also. So what is the problem to the fetus? Not children, I can say that it is the fetus. So what is the problem or embryo? So it leads to the miscarriage, or second word, it is the abortion. So it is a miscarriage or abortion can take place, or sometimes there is a preterm labor. Now, what is the meaning of this preterm labor? See, term labor means what? Then you can understand what is preterm labor. Term means when the delivery takes place after completion of total 9 months, 7 days. That is 40 weeks. And what is preterm? If the delivery takes place before the 37 weeks and after the 28 weeks, then it is called as pre. Pre means something prior to it. It is called as a preterm labor. That may be the chances of it. Next, what is the low birth weight of whom? Of what is the newborn? Because if mother is not able to take the proper diet, so what happens if the female does not have the nausea and vomiting? What will it lead to? Whatever the weight of the fetus, it is normal. The next question, how much is the normal weight? Normal weight of newborn, it is from 2.5 kg upwards to 3 to 3.5. So that is the normal weight of the fetus. But if the neonate and if the weight, if the mother is having continuously nausea and vomiting continues throughout the pregnancy, she is not able to take the food properly. And if she is not able to take the food properly, but obvious, the fetus is not going to take the nutrient properly. And if fetus is not getting the nutrient properly, there is not proper growth of the fetus. And simple thing, whatever the newborn which is born is having less weight than the normal. That is weight, newborn weight, it is less than 2.5 kg is called as low birth weight. Second word, it is LBW. LBW, that is low birth weight. Related, this terminology is related with the newborn. Right? And the miscarriage, it is the abortion which is responsible. And how much percentage, right? So if you see the 100 hyperemesis gravidarum pregnant females and having the vomiting, out of that 25% leads to this miscarriage. So the continuation of miscarriage in this is abortion. So continuation of pregnancy is not fine. So there may be some development delays. What is meaning of developmental delays? So whatever the development which we see in the embryo development at some specific time, the brain is developing properly. At specific time, the heart is developing properly. Then whatever the development of the proper organs, so whatever does not take place properly. So there is a developmental delay, or sometimes there is a congenital heart disease due to this, and sometimes there is a skeletal malformation. Sometimes you say that whatever the back region is not properly, whatever the structure, anatomical structure which is present, skeleton point of view, they are not developed properly. Sometimes you're having club foot or club hand, that structure, that is what is present. So that may be the scenario. What is we see in the club foot or club hand, that is what we see in the movies, like Bahubali, that's what we have seen. And that what is the that person, uncle of that hero, how it is a hand it is. So that is some skeletal malformation. And sometimes the behavior and the emotional problems also. That is from the psychological point of view. What is the behavior problems? We know that if we we are having some uh, get together, social moment. It is the happiest moment. We remember the proper happy moment. If there is a sad moment, we are having the sad moment. What is the emotional problem? What is emotional? Everyone is in life is having many problems, whether it is the sad moment, whether it is the happy moment. Everyone is having this emotions. Emotions that is the anger, grief, love, hate. These are different emotions of that person. But if the mother is suffering from the hyperemesis gravid during the pregnancy, whatever the newborn is suffers from that of emotional problems. So they are not able to cope up some stress. Everyone is having like stress, everyone is having like anger, all the emotional problems. But such units are not able to manage it properly. So there are some emotional problems can lead to stress. So that is the importance of why we are saying this hyperemesis. Next is, but there are some biological changes, which is means what happens whenever there is a vomiting takes place. What actually happens? You vomit it. What is vomit consists of? It consists of some liquid. So what it makes to fluid from your body, it is removed from it. Along with that, it removes the important that is sodium, potassium, it is removed. And then what is the importance of sodium and potassium? So you remember in the physiology first year you do some that action potential in the cell. And that cell what is required the sodium and potassium from the cell membrane that exchange takes place. And if it is proper, then cell is doing its function properly. And what happens? The space between two cells, it is the extracellular space. And in that, whatever this fluid which is vomited out, so there is a in vomiting, there is a loss of sodium, there is a loss of potassium. So what all this combinedly leads to that of loss of loss of sodium and potassium. And this less of the sodium and potassium, the word is called as hypo. Hypo means something less. So there is a hyponatremia, hypokalemia. Kalemia means potassium. Natremia means sodium. So there is an electrolyte disturbance. That's what we are going to observe. Then hypovolemia. What is that? Is the range hematocrit value. Means what happens if from the volume it is less. So definitely vomiting is continuously. It leads to the hypovolemia. Then next, hemoconcentration, that is increased viscosity. Simple logic, that is, if the liquid part gets removed, gets out from the volatile part. So whatever the remaining part leads to the increase in its density point of view. Viscosity is going to increase, and that leads to the hemoconcentration. See, the blood is consists of some specific plasma. Then there is the inside of this RBC, WBC, whatever are there, solid part, and liquid part. And if liquid part it is becoming so but obviously it leads to the increased viscosity, and so that there is the that is hemoconcentration, it is increased. That is pathophysiology or what is biochemical changes which takes place. And but obviously, if volume is less, so whatever the blood which goes into the kidney, it becomes less. So, and the pressure is also less. So, if the pressure is less, blood pressure is less, kidney is not able to do the function of filtration. And if kidney is not doing the function of filtration properly, so whatever the urine which has to go outside, so it is less. And if it is less, the condition is called as oligo. Less means oligo. More means poly. So what is simple? What is going to be there? So less output. So less output is called oligouria. Then the starvation is there. Starvation means not getting the proper nutrients. That is called as starvation. And then if cell are not, cell, we know that in cells there are two types of aerobic and anaerobic metabolism which takes place. And if there is a glucose is not taken properly, oxygen is not taken, so there is an anaerobic metabolism. And from that anaerobic metabolism, from the cycle, what is the drawback? Because cell has to produce the ATP. because cell has to do the function, and for that ATP, it both, if the glucose and oxygen is properly, then aerobic metabolism takes place properly. But if there is a lack of it, then it's not anaerobic. But what is happens that the water content is not glucose, the mother is not able to take this nutrient properly, the cell starts the other way. And other way, what is the drawback? ATP is generated over here. But what is the drawback over here? It is the ketone is extra produced. So there is a ketonuria with metabolic hypochloremic alkalosis. That is the thing. And if a severe, if one severe case is there, then there is a more oxytocin bodies which are present, and that leads to the situation that is called as a metabolic ketoacidosis. And all this is because of improper getting of this nutrients, because the female is not able to take the food from by mouth, anything. So that may be the biochemical changes which can take place. So that is biochemistry will know it. Then, of course, sometimes there is a vitamin deficiency because the female is not taking the food properly. So there is a vitamin deficiency. Which vitamin? That is the B6 and B1. Okay, and whatever there is abnormal thyroid function test. Out of two-third cases, means about some 100 patients comes to me, so there are 75, two-third of out of one, two-third cases are suffering from that of thyroid problems. So what is it? It is a biochemical thyroid toxicity. And trace thyroxine with or without suppressed TSH. TSH normal. If you do the investigation of such levels, so TSH level, it is sometimes it is suppressed, sometimes it is low, or sometimes it is not low. But sometimes what you see that thyrotoxicosis, what is the eyeballs or protruding outside, that is seen of how it looks like. And there may be some abnormal liver function. Liver is not doing its functions properly. So there is an abnormal liver function test. What is how you do the chemical analysis of it? Means what is this? If you do it in a female of pregnancy and come with that after 7 months amenorrhea and having excessive vomiting, and if you do the investigation, if you advise the TSH level, if you advise the vitamins, and if you do the investigation of liver function test, then you observe that even by clinical examination, you see that in thyrotoxicosis, there is a eyeball protruding, that symptoms signs of pain, and whatever other means you see that investigation, that is the liver function test, which is abnormal. Then there is on vitamin B6, there is a deficiency. What you observe it in TSH level, sometimes it is low, sometimes it is not. So this what is we are going to observe in investigation report of such problems. Now, then it's how it is clinically. This is what you see from the symptoms point of view, from the biochemistry point of view. Now, clinically, how we are going to see it. It starts as a morning sickness that becomes aggravated gradually. Initially, it is just morning sickness, but it is continuously increasing. There is a sunken eye, dry tongue, dry wrinkled skin, because these are the signs of dehydration. This is signs of dehydration. You know that dehydration, that is fluid is not properly. So if you don't take, how is your eyes, their nice glowing skin is there, your tongue is moist, your skin is having proper texture, that is the proper texture. So if there is a dehydration, so how it is the eyes go deep, sunken eyes. Then the tongue, if you say it is a dry tongue, and skin wise, it is not proper glow to the or not consistency. Then there is a urine output. If you ask it how much urine it is, if it is an admitted patient, then you see that in hospitals that is the urine fat. So it is not normal. It is 1,200, 1,500 ml urine is fast, but it is if you say urine output, it is less. So all these symptoms you can see in the dehydration. Then what is other from the it's starvation? What is starvation? Not able to eat properly. So whatever nutrients is not getting properly. How the patient it is like obese? No, the patient it is very emaciated. There is a loss of weight also. So what patient says that previously the weight it is, for example, the patient is before the non-pregnant, the weight it is 54. Then initially it is from 55, 55, 56, but 55. But when the nausea and vomiting continuously, there is a weight loss. Patient becomes very lean. So that we can see that. Or there is a loss of weight, which is normally there is an increase in the weight. How much weight should be increased? It is about 10 to 11 kg throughout the pregnancy. So if the female is having weight of 54 before the pregnancy, then up to the 9 months, she should get the weight up to the 64 to 65. That is normal thing. Then general examination. What we have to do is, it is the vital signs. See, what is basic things? There is a fluid loss is there. So what we have to maintain vital signs, that is the pulse, BP, temperature. That what we do. So simple. If the what we see that fluid it is lost. How much? What should be the BP? If fluid is not there, so there is no pressure on the wall. So definitely blood pressure is going to be decreased. And then tachycardia. Why tachycardia? Because heart has to pump more as compared to normal. If heart it is having proper pressure and proper blood, please mute it. Mute. Someone is having disturbance. Please mute it. Okay. Thanks. Why tachycardia? Because blood, whatever the heart, it has to pump, and if there is the whatever the return is not properly, because the blood pressure is down, so there is a less return into the right atrium, less return into the right ventricle, less go to the left atrium, and less means blood into the left ventricle. So what happens? The heart has to pump more than the normal rate. So if it is more than normal, then it is called as a tachycardia. Managed, and there is a subnormal temperature because the blood is not flowing properly. So there is a subnormal temperature. Someone is having disturbance. Please mute it. Please mute it. Right. So there is a subnormal temperature. Then jaundice in severe cases. Sometimes the liver is there is a not being functions. So it may be pre-hepatic or hepatic and post-hepatic. So there is a jaundice in severe cases, and urine. But obviously, what we see that oliguria. If there is in the late cases, we can observe the oliguria. Then it produces at nervous level manifestation. That is, in severe cases, there is a thiamine B1 deficiency. So there may be peripheral neuritis that which can lead to that. Or what situation there is a pain in the hands and legs, and there may be some tingling sensation in the hands and legs, and whatever all this because of a B1 deficiency. The patient is not taking food properly, not able to eat anything. But obviously there is a B1 deficiency, and which is required for the nervous system. And if it is not properly, so there is a pain sensation in the hands, there is a tingling sensation. So that kind of symptoms. Or there is a vernix encephalopathy. What is vernix encephalopathy? It is the trial of all these three. Which one is eyes? That is oculomotor abnormality. Which one? It is the nystagmus. Nystagmus means eyes are turning towards its side or opposite of it. That is the nystagmus. There is a diplopia. Diplopia means double vision. That is diplopia. And optic neuritis. That may be the oculometry. That is vernix encephalopathy. What we are going to observe is, and sometimes there is a cerebellar dysfunction. The cerebellum is not able to do its function properly, and sometimes there is an impaired mental state or sometimes mild memory impaired. So impaired mental state, not able to do the functions properly mentally, or some mild memory. Don't remember what happens. Okay, female says that where I kept my keys, I don't remember it. What happens is that I don't remember it. So, but it is not severe. It is just mild memory impairment. So she does not remember what happens. These are because of some related with that of nervous system. Fine. And then there are some severe cases, it can lead to death up to 20%. So out of 100, means 20% can have a death. And sometimes there is a Korsakoff syndrome. That is, what is it? Confusion and loss of memory for recent events. So patients say that whether I have to do this or whether I have to do this. To be or not to be confused. And loss of memory of recent. What is meaning of recent events? So if we are done with something, okay, such women say that, oh yes, we have done such things in the yesterday. She don't remember it. And family members say, yes, you have said to me such things that we have to go outside. And the next day patient says that, okay, I have said it. So she does not remember whatever the events which can take place in the previous day. So that is called as recent events. That is called as Korsakoff's syndrome. How clinically this is to be present. Then now, okay, now you have find that one female patient comes to you of some 7 months amenorrhea because hyperemesis gravidarum, it is related with that of amenorrhea with that of excessive nausea and vomiting. And if that female patient comes to you in your OPD, which investigations you are going to advise it? So for the investigation, what we have to do it is the ultrasonography. Then the ultrasonography, what we have to do it in ultrasonography to exclude the multiple pregnancy. Just 1 second. Papa, lecture. Hello. Then ultrasound. Why we are doing ultrasound? What is the intention? Always when we are saying to do investigation, so why we are saying this? So first of all, ultrasound we are advising it, but why we are advising it? To exclude multiple pregnancy or to exclude vesicular mole or organ USP. A vesicular mole, it is the hydatiform mole where chorion are not developing properly. If you want to see in the introduction of abnormal part, I think it is in the second introduction part, I have given the example of vesicular mole. Then the serum electrolytes, because we know that what happens, vomiting is there is a loss of sodium, there is a loss of potassium. So which investigation we have to do it? That is the serum electrolytes. That is what we have to observe in hyperemesis gravidarum. What we see that is the decrease of sodium, potassium, and the chlorine. That's Cl. And next, what we have to do it is the renal function test. We have to do it. Then liver function test. What we have to do it. Because and the thyroid function test we have to do it in thyroid and liver function test. Then serum amylase, then you have to do the urine analysis, then complete blood count you have to do it, and ophthalmic and neurological examination. Because what we see that it affects with thiamine deficiency, which leads to on an other leads to the ophthalmic and neurological examination we should do it in case of hyperemesis. And next one is that is okay, you do the investigation and the patient come with that. There is a report that it shows some drastic changes in the general examination. BP is low, there is a tachycardia. Then other investigations you have observed for multiple pregnancy sometimes, and there is sodium potassium, it is less. Now next question, hospitalization. So in that, what we have to do is it is the ABC maintenance. What is ABC? Airway, breathing, circulation. Whether there is any problem with airway, no. If there is a problem with the breathing, no. So if there is a problem with the circulation, yes. Why? Because there is an excess of vomiting, so fluid loss is there. So we have to maintain that, and there is an electrolyte. So what is the treatment? If fluid is lost, give the fluid. Which one? That is the intravenous fluid we are going to give it. The next vomiting is there. So what we have to advise, it is the medication we have to advise. And second thing, medication, so that she does not feel that sensitivity is present. Then nutrition, because she's not able to take the nutrient properly. So we have to do the nutrition. and then thiamine supplements and the thromboprophylaxis. That is, in case of that, what is the DVT, prevent of it. So thromboprophylaxis. Prophylaxis, that is something preventive measures that what we are doing. Okay. Then what is intravenous fluid? That is normal additional KCl. Then daily monitoring of electrolytes. That is, we have to properly daily, that is sodium, potassium, and chlorine. That's the CM. That's what we have to observe. Then dextrose infusion is not recommended unless serum sodium level is normal and thiamine has been administered. So dextrose wise it and dextrose infusion precipitate vernix encephalopathy in thiamine deficient status. So that is what we have to observe. Then medication. So first vomiting is there, so what we have to give it something anti-emetic drugs. So which one is the anti-emetic drugs? So that is second of these drugs used together may be more effective than a single drug. So phenothiazines, that is phenochloroperazine, that is larger 2.5 iron injection, schematic suppositories or antihistaminics, cyclizine 50 milligram by iron or IV injection 3 days. This is from the modern way of treatment. Homeopathic, we are going to discuss it afterwards. So there is a second anti-emetic, then third line anti-emetic model that increase oral fluids when they can be tolerated and record fluid balance, that is how much input, how much output, increase frequent snacks of safe foods, then able to, if she's able to take time out, then safe foods, that is simple dal rice, that what we have, no much of spicy, no much of this additional flavors, or assistance to eat when required. If you feel able to eat it, give it. Then avoid iron containing food. Then consider referral to dietitian. If there is a severe cases, you have to advise to dietitian. Then in thiamine, this is the or thermoprophylaxis that related with the advanced stages in case of dehydration and if patient it is better. Then follow-up for the maternal and fetal conditions. So when the patient comes for the follow-up, and we do the vital signs, that is twice or twice per day for hypertension and tachycardia. What we have to observe is the BP. If she is having hypertension or if she is again suffering from tachycardia, then again we have to do it for urine analysis. What we are going to observe? Acetone and chloride. Then frequency, amount, and characters of vomiting. Then how much vomiting? So which question it is asked? That is called as the hyperemesis chart. What is it? Question it as? Okay, vomiting. Since how many of days? Whether since means during this how many times? Whether once, whether twice, whether three times. Then quantity wise, how much amount? Then characters, whether it is yellow or whether it is any content of it or whether it is watery. That is called as a hyperemesis chart. So that question we have to also ask regarding when patient comes with that vomiting, hyperemesis gravidarum. Then daily fluid chart for fluid input and output. How many intakes of water or how many intakes it takes and how much output, urine output, that's what we have to observe it. Then serum electrolytes daily, that is sodium, potassium, that is. And the examination of the fundus oculi and the week per week. Then again, liver function test we have to do, but how much, not daily basis, it is weekly. The renal function test, again, it is weekly. And observe not for the mother, but from the fetus also. So which one? It is the fetal observation by the what we have to do is the ultrasound. If there is any problem. Then if there is a severe cases, what we have to think about it is the termination of pregnancy. So in termination of pregnancy, if it is a severe persistent vomiting unresponsive to all measures, then we have to think of the MTP. That is what you learn in the second year. MTP stands for medical termination of pregnancy or jaundice, or if there is a high blood urea, oliguria, or anuria, or in case of if there is a vernix encephalopathy. That is what we have seen in previously here. Yes, in vernix encephalopathy, in which condition? If there is a oculometer abnormalities, that is nystagmus, diplopia, optic neuritis, or if there is a cerebellar dysfunction, or if there is an impaired mental state or memory impaired, in that situation, you have to think about termination of pregnancy. In this, we are going to see the homeopathic medicine. So in case of, and if there is a vaginal hemorrhage, bleeding has taken place. So in that situation, you have to think about the termination of pregnancy. Then complementary and alternative therapy is sometimes used, but we are dealing with the homeopathy. So in that same, what we have to use is homeopathic medicines are there. Sometimes we have to use the arsenic and burn. Sometimes we have to use the pulsatilla. Sometimes we have to use the Naxomica. Sometimes we have to use the nitram salt. If in case of, we are going to see in the detail about the arsenic, but we see that if the patient is having that specific complaints of nausea and vomiting, if it is aggravated during the daytime or if it is aggravated during the night times, that is 12 a.m. or 12 noon, 12 noon or 12 a.m. and p.m. So that at that time we can think about the arsenic. And how is the arsenic? Arsenic patient is very restless. So patient comes in, say, okay, see how she speaks with the doctor. Sir, can I have any problem? If there is a problem to that, because if I'm going to suffer from anything, so she's continuously asking anxiety what we are going to observe. And if the complaints are more on the taking some stale food and restlessness is there, patient is chilling and the thirsty, so we can think about the arsenic. And if pulsatillar female, if the female says that I go to the party and I just eat some paneer sort of, and then I took the ice cream and I took the stick in the bed and got bed in the rain, and then she started the complaints of this nausea and vomiting. Then we are thinking about the pulsatillar. Pulsatillar patient, there is no thirst. Patient is thirstless, so we can think about it. And the patient is very busy. Patient is talking, oh, I'm suffering from this, suffering from this such complaint. What is going to, and within, it is normal sort of, I'm having this complaint. That sort of behavior is there. So we can think about the patient. And if it is the next one, the payment says, oh, what is the problem? I don't believe it. Still the tone of the patient. Next one, the patient with highly chilly patient, and the patient is having the desire for some specific spicy food, and where it is called as psychic personality, it is having highly standard life patient having some parties at night and the desire for some spicy food and complaints that she can continuously vomiting, especially early in the morning. Then we can think about it. And the nitram salt is also there. But in nitram salt, there is a respiratory plus GIT complaint with vomiting of greenish color, and also there is a respiratory complaint. Then we can think about the nitram salt. So this is from the homeopathic point of view, how we can learn to think about. And sometimes epithet is there. In epithet, there is a nausea and vomiting, but clean tongue. See, tongue is clean in the this one, epithet remedy. So we can think about the epithet remedy. These are the some homeopathic remedies that how can we clinically differentiate between these remedies. That is, arsenic is there, pulsatilla is there, naxonica is there, natural is there, and epithet is there. Out of that, all are thirsty except pulsatilla, which is thirstless remedy. All are mostly are chili remedies. So how we can differentiate between this arsenic, pulsatilla, then naxonica, that himself, and the epithet. In that arsenic wise constitution wise irritation, weight claim, having proper dress code, all these things. While pulsatilla, not from dress code, but she's talking wise, blue eyes and blonde hair, that's what we observe in the pulsatilla. And very talking is in the morning language. Oh, I'm suffering from this. So talking wise, what we see that. And Lakshmanika, dark complexion is more there. And the stress powder. Lakshmanika is very straightforward. Immediately, out of it. I don't believe in homeopathy. Out of it. I don't believe in that. So that thing, if it is present in the female, so we can think about in how that we are going to compare different remedies. So I hope that you people have understand all these things, and still if you have any queries, so you can ask it regarding if you don't understand that is related to the proper part, and again this type of homeopathic therapy. So that is in short what we have seen. That is the concept of what is hyperemesis gravidarum, and what is symptoms wise, it is clinical features we have seen, what is the investigation we have to cover it, and what is the homeopathic point of the treatment. Fine, I think you people have understand. If you have any queries, please let me know. Just additional short topic, hyperemesis, gravidarum, and that is related